It's Leslie. It's time for another episode of Carpool Karaoke with Leslie and Kathy. Except there's no car today, there's no singing, and thanks to COVID-19 and social isolation, there's no Kathy. I thought, what a better time than right now to talk about quitting smoking. Because now we have a whole new reason to quit, and that's COVID-19. Because guess what, folks? It looks like smokers are at much higher risk. They're more likely to get infected, and when you think about it, every time you have a cigarette, you make this repetitive motion about 10 times. Pack-a-day smoker, that means 200 times a day you're touching your hands to your face. That's 200 more opportunities to deliver the virus to your respiratory tract. Not only that, but from what we know about COVID-19 and the China experience, smokers were way more likely to die, 3 times more likely to die, and more likely to require respiratory support. So now's the time to quit. So how can we quit? Let's talk about quitting easily with nicotine replacement products. And I shouldn't say easily. Quitting smoking is hard. Probably one of the hardest things you're ever going to do. But it's pretty easy to pick up nicotine replacement products because you can get them in your pharmacy without a prescription. So, what do you need to do if you want to quit smoking and you decide you're going to use a nicotine replacement product? Your best bet is the patch. So the patch provides nicotine in a 24-hour, if you will, continuous infusion through your skin. It's absorbed through your skin. And it just contains nicotine, by the way, not all the toxins that are in the tar of a cigarette. So you want to dose it correctly. A lot of people who say nicotine replacement doesn't work, well, that's most likely because you haven't used it correctly. So how do you dose it? For every cigarette that you smoke, you get about 1 milligram of nicotine. So that means you need a milligram of nicotine replacement for every cigarette you smoke. So if you're a pack-a-day smoker, that's 20 cigarettes or 20 milligrams of nicotine. So you need the step 1, 21 milligram nicotine patch. If you smoke 2 packs a day, you're going to need 2 of these puppies. If you smoke 3 packs a day, you're going to need 3. They come in a 14 milligram and a 7 milligram strength as well, so you can match your dose to your number of cigarettes. So when you get the product, you cut open the top, take the patch out, remove the adhesive backing. You can put it anywhere on your body between your neck and your waist. Pick a hairless area, unless you also want to do some waxing, because it'll hurt when it comes off. So anywhere on your body, on your arms, your forearm, your back, just make sure that you don't put it in the same place 2 days in a row, because after a while the adhesive starts to irritate your skin. So rotate your parking, put it all around different places on different days. Keep it on for 24 hours. It's like your underwear, change it once a day, get up in the morning, take it off, put on a new patch. This will give you 24 hours streaming, if you will, of a pack a day's worth of nicotine. If you use a patch by itself, it's pretty good. It doubles your chance of quitting successfully over going cold turkey. It eases the pain of quitting. But there's something else you can add to it to triple your chance of quitting successfully and help deal with those nasty little cravings that pop up unannounced. And those are by supplementing the patch with a shorter acting nicotine replacement therapy. And there are 4 different products on the market. They're all absorbed through your cheek. And they include the gum, the nicotine lozenge, the nicotine spray, and there's another product called an inhaler, which I don't have with me at home today, but it's a little white plastic puffer device that you put a nicotine cartridge in. And any of these products can be used along with the patch. You just use them when needed when you're having a really bad craving. Again, you want to make sure you use them correctly. If you're using the spray, you have to push in on the back and push up till you get this green, then you know it's loaded and ready to use. If you haven't used it in a while, you know, a day or two, you'll want to give it a couple of sprays just to prime it till you get a nice stream of mist. And then when you're using this product, you simply open your mouth and either spray it underneath your tongue or up to the side of your cheek. You do not want to spray it to the back of your throat. It'll be very irritating. So to the cheek or under the tongue. It has a really strong mint flavor. Some folks don't like that. If you really find it intolerable, you can spray it on your finger and then rub your finger on the inside of your cheek, or you can get, there's a berry flavored one as well. Each spray delivers the equivalent of about a cigarette. Okay. Quick mist spray, it's the fastest acting of the short acting, starts to work in about a minute. You can also use a nicotine gum product, and these products should not be chewed like regular gum. So you put it in your mouth, you give it a couple of bites, you start to get this tingly, peppery sensation. That's the nicotine. As soon as you get that, you want to park the gum between your gum and your cheek, and wait until the peppery sensation subsides, and then bite it again a couple of times. So essentially what you're doing is bite, bite, park for about a minute, bite, bite, park, bite, bite, park, bite, bite, park. That's how it works. If you chew it too quickly like regular gum, you'll end up releasing too much of the nicotine. Some of it will go up to your head and make you dizzy, but most of it you'll swallow, and it'll bind to nicotine receptors in your stomach and make you sick. It won't help you, however, with your sudden craving. So use it correctly. You can also get the nicotine lozenge. Here it is, just a little white tablet. It's not to be swallowed with water. It's a lozenge. So you suck on it, and it works the same way as the gum. So suck, suck, park. Suck, suck, park. And that's how that baby works. If you use those products together, you'll stand a much better chance of quitting, and quitting successfully and less painfully. It eases the pain of nicotine withdrawal for sure. And there's other things you can do as well to manage cravings that don't require nicotine products. Keep busy. A craving usually only lasts a few minutes, so do a puzzle, play a game on your phone, do a crossword, go for a walk, fold laundry, suck on a lollipop, suck on a frozen cherry, chew carrot sticks or a crunchy apple, chew some regular gum, chew on a toothpick, chew on a straw, drink ice water, go out and brush your teeth. All kinds of things you can do to delay that craving. And you got lots of time to do it now that, just like me, you're stuck at home. Happy quitting, folks.